You've been listening to the Health Broadcasting Service Radio, your radio of excellence and distinction on everything health. Coming up next is HBS Health News in Review. Stay tuned.
Health Broadcasting Service, HBS Radio. HBS Radio is who you're looking for.
Weekly Health News in Review coming to you from the Health Broadcasting Service, HBS Radio Live channel. According to reports from Reuters, China's zero-COVID stance has put it at odds with the rest of the world and is exacting a mounting economic toll. But an exit strategy remains elusive as authorities worry about the ability of the healthcare system to adapt to new strains. And on that note, let's begin with the current pandemic deaths and infections rates across the world. As always, please remember that total infections and deaths for each country include both confirmed and probable infections and deaths where that data is available. If probable infections and deaths are not reported by a country, we only use confirmed infections and death rates. The data are no complete count of every COVID-19 infection and death in all countries, as the counts are based on the best available information accessible to Reuters at any given time. Countries may miss infections and deaths for any number of reasons, such as delays in processing testing data, lag in reporting, lack of testing, and so on. Some countries may exclude certain categories of infections and deaths that others include, for example, probable infections, or have different criteria as to what may be counted as a COVID-19 infection or death. Some countries change the way they report to include or exclude a certain category of infections or deaths, which can lead to a significant increase or decrease in their total and what they reported previously. And so against this background information, let's look at the data of some randomly selected countries current at the time of this review. We will start with the United States of America, the USA. The United States of America leads the world in the daily average number of new deaths reported, accounting for 1 in every 4 deaths reported worldwide each day. The United States is currently at 63% of peak at the timing of this report and falling. 1,119 infections per 100,000 people has been reported in the last 7 days at the time of this report. The average number of new infections reported each day in the US falls by more than 203,000 over the last 3 weeks, being 26% of its previous peak. COVID-19 infections are decreasing in the United States, with 510,207 new infections reported on average daily. That is 63% of the peak, the highest daily average reported on January 15. There have been 74,317,645 infections and 887,703 coronavirus-related deaths reported in the US since the pandemic began. Let's look at the United States of America's vaccination history. United States has administered at least 538,829,920 doses of COVID vaccine so far. And assuming every person needs 2 doses, that's enough to have vaccinated about 82.1% of the country's population. We will next shift our focus on Armenia. The average number of new COVID infections reported in Armenia each day reaches new high, now reporting more than 2,100 daily. COVID-19 infections in Armenia are certainly at their peak, and at the time of this report, the highest daily average reported stands specifically at 2,103 new infections each day. Armenia is at peak and is still rising, with 497 infections per 100,000 people reported in the last 7 days at the time of this report. The average number of new infections reported in Armenia each day reaches new high, now reporting more than 2,100 daily. There have been 366,433 infections and 8,046 coronavirus-related deaths reported in Armenia since the pandemic began. Armenia's vaccination history. Armenia has administered at least 1,825,382 doses of COVID vaccines so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 30.9% of the country's population. Last but not the least, let's look at Iran. Iran reports highest number of new infections since September, currently at 34% of peak and still rising, with 112 infections per 100,000 people reported in the last 7 days, confirmed at the time of this report. The average number of new infections reported each day in Iran rises by more than 12,000 over the last 3 weeks, 30% of its previous peak. COVID-19 infections are certainly increasing in Iran, with 13,384 new infections reported on average each day. That is 34% of the peak, the highest daily average reported on August 17. There have been 6,344,179 infections and 132,424 coronavirus-related deaths reported in Iran since the pandemic began. Iran's vaccination history. Iran has administered at least 131,617,252 doses of COVID vaccine so far. Assuming every person needs 2 doses, that's enough to have vaccinated about 79.4% of the total country's population. Let's now look at the continents, and we will start with Europe. The EU's drug regulator gave the green light to Pfizer Incorporated antiviral COVID-19 pill for treating adults at risk of severe illness. Booster shots could reduce future hospitalizations in Europe by at least 500,000, the EU's public health agency said. And after a relatively brief return to coronavirus restrictions triggered by the Omicron variant, England is going back to Plan A, learning to live with the disease. Sweden has decided against recommending COVID vaccines for children aged 5 to 11, the health agency said, arguing that the benefits did not outweigh the risks. Meanwhile, Poland and Russia reported new record daily infections, while the number of new infections in Germany exceeded 200,000 in a day for the first time. And in Austria's new daily coronavirus infections have surged to a record level, Austrian media reported. Let's look at the Americas. New COVID-19 cases in the Americas in the past week have been the highest since the pandemic began, and the Omicron variant has clearly become the predominant version of the virus. The Pan American Health Organization confirmed. Let's look at Asia Pacific. Hong Kong will shorten its 21-day quarantine requirement to 14 days for incoming travelers starting from February 5, leader Carrie Lam said. And with just over a week until the Winter Olympic Games begin, teams are trying to ensure that athletes stay virus-free to get past Beijing's strict checks and make it to the start line. Beijing has limited the movement of people in more parts of the Chinese capital, even as it reported fewer COVID-19 cases in a bid to lower virus risk ahead of the Games. And Australia reported fewer COVID-19 deaths on Thursday, a day after recording a pandemic high, while hospital cases remain steady, raising hopes the country's worst outbreak may have peaked. Next, we'll look at Africa and the Middle East. Protesters against COVID-19 measures who liken themselves to Jews under Nazi persecution are stoking global anti-Semitism, the Israeli government said in a report marking International Holocaust Remembrance Day. Turkey has recorded 82,180 new COVID-19 cases in 24 hours, its highest daily figure. Meanwhile, tennis player Novak Djokovic is set to return to action in Dubai next month for the first time since he was deported from Australia over his vaccination status. Medical developments. COVID-19 boosters increase protection against death from the Omicron variant to 95% in people aged 50 or over, the UK Health Security Agency said. China's Walworks Biotechnology has recruited most of the 28,000 participants needed for a large clinical trial of its mRNA COVID-19 vaccine candidate, a senior company official said. And finally, before we round up, let's look at the economic impact. U.S. stocks painted a mixed picture as investors digested how strong economic news could inform the Federal Reserve's thinking on interest rate hikes, while the dollar hit its highest level in over a year. Meanwhile, British financial services exports have struggled to recover from the twin hits of COVID-19 and Brexit and are lingering at levels last seen in 2006 when adjusted for inflation, new data has shown. And on this note, we will round up on this week's episode of our weekly news review. We will be back next week with more. Please remember to press the subscribe button below to stay abreast of vital and authentic global health developments coming to you from the Health Broadcasting Service.
Health Broadcasting Service, HPS Radio, HPS